When I still walk around the grounds of Cumberland, and that's something I invite you all to do before it goes, just walk around the grounds and think of the people who have been there. Think of the patients. If you go and find the old sandstone steps and you see the impressions, the gentle marks that thousands and thousands of patients must have stepped upon those steps to erode the sandstone, and how they must have been over that period of 175 years.
Like working at Cumberland, there's an emotion to it. I never thought that you could fall in love with these inane objects that just cannot reciprocate your love. Like, you fall in love with, basically bricks and mortar. And so with Cumberland, the history of Cumberland becomes my history because of working there. So, and then when you think that I am now working in an area that people 175 years before me worked looking after the mentally ill, well, I'm still there.
And it's extraordinary to think and reflect that Cumberland Hospital, which has been accepting mentally ill people since the year 1849, it's extraordinary to think about how large it grew over that period of 175 years, from 1849 through to 2024. Over many years, there were well over 1,000 psychiatric inpatients, and at times that is believed to have topped 2,000 psychiatric inpatients. Now, if you just stop and think about that, you need to reconceptualise Cumberland Hospital. And don't think of it as a hospital. It really was a small town. It was a community within a community. And I think that's how it saw itself.
In Rebecca Williams' time, you see, they were the occupational therapists, they were the diversional therapists, they were the social worker, they were the cleaners, they were the cooks. They did everything.
My observations are that there's no other professional group within mental health that work so closely with the mentally ill as nurses. As a doctor, I'll often do a review, maybe a ward round. I might spend an hour with someone. But nurses, day in, day out, spend their entire time interacting with patients. And I often feel it's their stories, their reflections, that give us the deepest understanding of patients, who they are as individuals, and how they're cared for.
When somebody has opened up their life to you, that is a privilege to be part of, that they have trusted you with this information. That's gold, and I thought you've got to treat that with the ultimate respect that they're giving you to tell you. So again, it's a privilege.
The history of Cumberland, I think, is a perfect example of how the care for the mentally ill has changed over 175 years. There are moments where there have been dark moments, like all histories of mental institutions. But for the most part, my experience of Cumberland Hospital since the mid-1980s through to 2024 has been one of growth and of changing attitudes. And I believe that all aspects, medical care, nursing care, and general care towards the mentally ill has improved. And I hope it does so in the future.